Good morning. This is Dr. BABAK MOEIN. I'm board certified in general surgery and specialized in cosmetic surgery. Today we're going to go over submental liposuction, aka chin liposuction. When can normal activity and exercise be resumed? You can typically start normal activity and exercise within 7 days after the surgery. So the surgery is not prohibitive with time. What is the cost range for submental liposuction? The cost range of submental liposuction depends on what city you live at. The cost range can vary from $7,000 to $10,000, and it depends on the type of technology, whether you use anesthesia, and whether the amount of fatty tissue that needs to be removed is significant or minimal. So all these variables play into your final cost. Does insurance cover this procedure? Unfortunately, insurance will not cover any cosmetic or aesthetic procedures. Can submental liposuction be combined with other procedures? Submental liposuction can be combined with multiple different procedures. Some of the procedures it can be combined with is things in the face. For instance, if you need fat grafting to your face, it can be combined appropriately. If you need laser of your face, it can be combined appropriately. If you're having body work done, such as breast work or tummy tuck, can also be combined appropriately without significant amount of issues with one or the other procedure. How does aging affect the results of submental liposuction over time? Aging can diminish the results of submental liposuction by increasing skin laxity in the lower chin and jaw area. However, when combined with Renuvion-J plasma skin tightening procedure, we tend to have much better long-term results because it adds a significant amount of skin tightening and rejuvenation in the fibroseptal network of the neck. What are the alternatives to submental liposuction? Some of the alternatives that I see that is popularized on various different channels is things like Kybella and radio frequency devices that don't add value by removing the fat. These type of procedures do not have significant amount of effectiveness as compared to submental liposuction. Submental liposuction is truly a balanced approach by addressing the fat, by removing the fat, and something that Kybella will never be able to do. I've seen multiple patients who come to us having had Kybella before and then having significant amount of scarring in their lower neck area. So it's important to choose the right procedure and not put yourself at risk with a procedure that is less invasive but causes more problem. So to not put your body at risk with a procedure that is not effective and does not address your problem and can cause problems long-term for you. How does skin elasticity impact the outcome of chin liposuction? Skin elasticity has a direct impact on the result of chin liposuction. Typically, our decision towards who gets chin liposuction is completely prefaced on whether they have significant amount of chin elasticity or not. If they have a lot of chin elasticity, we have to recommend a lower face and neck lift or lower neck lift as a platysmoplasty versus liposuction, which often confers just removal of the fat. Typically, for patients that we're removing of fat just from the neck and they have minimal amount of elasticity, then we can address it with Renuvion-J plasma for skin tightening. What are the common side effects during recovery? The common side effects during recovery include swelling and minimal amount of irritation and pain due to wearing the head garment. The head garment is not very pleasant to wear, but the results of wearing the head garment has significant impact on long-term and short-term improvement of what you will see as the final product of this procedure. So how can patients minimize swelling and bruising post-surgery? The most important action the patient can take is to wear their garment appropriately. I can't emphasize this point enough, and to make sure that there's not too much pressure by using a foam garment on top of it, the head garment, to dissipate the pressure evenly in the neck. So typically we have a foam placed, and then we place the head garment. That minimizes any type of bleeding from small little vessels after surgery and minimizes the swelling after the surgery. And in the days that ensue, the tissue swelling goes down, the tissue starts tightening and really grasping the underlying fibers to stay up and not fall. That's why it's important to have the garment worn all the time in the first 7 to 10 days after surgery. Are there any dietary and lifestyle modification after the procedure? Certainly, you want to make sure you're mindful of your diet. You want to make sure that you avoid any fatty food and especially heavy caloric food after this type of procedure. Overall, we're removing the fatty tissue in that area, so we don't want it to be replaced with other fatty tissue in that area. We want to minimize that. Other important issues that you need to consider is to make sure that you get plenty of rest and avoid excessive exercise in the first few weeks after surgery to allow this tissue to heal appropriately and, as we say, stick up into the neck area without stretching of the neck area. How many follow-up appointments are typically needed after this procedure? The minimum number of appointments that's needed is around 4 appointments. I see my patients typically in the first week 1 time, then I see them within the first month, then I see them at 3 months and at 6 months to make sure everything is healing and the patient satisfaction is guaranteed. I follow my patients very closely. The reason I follow my patients very closely is I have seen various different things that can happen that can cause problems, such as wearing the head garment inappropriately, changing the position of the head garment and the foam, putting the band inappropriately, or things related to diet and healing process that one needs to be mindful about. And without seeing the patient either through one-on-one interaction or through some kind of Zoom interaction, you can't make sure that everything is going according to the plans. If you're a traveling patient and you're coming from a different area, we typically can perform our second and third and fourth follow-up through Zoom or other types of media that allows us to see you and examine you visually. So what qualifications should patients look for in a surgeon that performs this type of procedure? Typically, the qualifications that you want to look for in a surgeon is to make sure that they're board certified, they have good understanding of the knowledge of surgery and what needs to happen. But more important than anything that I don't hear surgeons talking about when they discuss this is they care. Caring goes beyond and above all these different qualifications because it's at the heart of making sure your patient does well. If you feel that the place that you're going is a mill and they're just trying to get you in as another number, then be aware because they won't spend the time or the effort to ensure your safety and make sure that this procedure is done with minimal amount of pain and their follow-up is appropriate. When your doctor spends time with you and makes sure you have an understanding of the procedure, you have an understanding and doesn't rush you, then you know you're in the right place. The procedure itself, the technical aspects of this procedure is something that can be easily learned. But knowing who is the right candidate for this procedure and who's not the right candidate for this procedure is truly where the most important aspect of this procedure lies. So make sure that you discuss your expectation, your goals with this procedure, and make sure that you listen carefully to the recommendations of your surgeon. How can patients ensure they have realistic expectations? Typically, when I do a consultation with a patient that is concerned about submental liposuction, I make sure that I review before and after pictures with the patient. I make sure I ask them what their expectation is and what their understanding of neck liposuction is. There are many aspects of the neck liposuction and the results that one envisions, and we have to make sure that the patient has very parallel understanding to what is in our mind when we talk about this. Pictures are very helpful in making and ensuring that understanding. We definitely do pictures while we're doing the consultation, and then we demonstrate with lines and arrows on how the expected results will often look like. That's a clear communication for the patient to understand what the results would be. What questions should patients ask during their consultation? Some of the basic questions that you need to ask is, how many procedures have the surgeon done in this type of procedure? You should ask, what type of devices do they use to achieve these goals? You should ask what type of place and facility the procedure is performed. You should ask, what are the safety measures that are taken to perform this type of procedure? These are very essential in understanding what your results and what your scope of risk would be with these type of procedures. Here are some patient success stories and testimonials. One of my dear patients, it was a young gentleman who came to me, and initially he was concerned about just gynecomastia. And during our initial assessment, I realized that he has significant amount of chin submental fatty tissue and extremely weak and deprojected chin. While we were talking, he asked me about chin liposuction, and it gave me an opportunity to present to him other issues that were involved in his lower chin and neck area. After discussing and looking at similar patients as him and demonstrating to him and how much chin liposuction and skin tightening and chin implant will improve his neck, he agreed to have the procedure done. Even though he came to me initially for the gynecomastia procedure that he had, the chin liposuction and the chin implant and the skin tightening that I did for him significantly changed his whole profile and his whole confidence. And he told me later that he is so happy with this, and he was so happy that he came to me because I discussed that with him, and the result of that is so phenomenal that he is just elated. As you can see in these pictures, you can see what an amazing improvement this made in this patient's life. And this is all a result of being able to correct some anatomical cosmetic things that this lovely patient was suffering from his whole lifetime. These type of issues are not superficial. These type of issues are really functional, and they're anatomical, and these type of deficiencies should not be looked at as vain or superficial type of procedures. This is Dr. BABAK MOEIN, Century City, Beverly Hills. Have a great day.